All right, so in our next discussion, I'm going to take you through the specific nutrition tools that you've been learning this week to help you gather and move forward and to initiate. So how was your Dr. Stone experience? How was your nutrition physical exam experience? I have been in the presence of Dr. Stone and some of our other colleagues where we have done a 24-hour nutrition physical exam workshop and still didn't feel like we left knowing enough. So there's so much to learn. So you've gotten to see some of the resources and tools this week to really set the stage for how much is out there and how much IFM has dedicated to our ability to expand our clinical physical diagnostic skills. Okay, you've just literally seen a glimpse of it this week. So know that the tools and the resources that support the ABCD approach and philosophy are very robust behind that education wall that you are now in full access to at IFM. So I just want to remind you that there's the physical exam report that's available. Some practitioners just keep this handy so they can jump back over and use it as a kind of a quick guide or a quick reference. Sometimes practitioners will use this sheet as a referral to somebody else in their office that might be doing the physical exam. You know, there may be this dynamic going on between different individuals in the practice. Okay? So look at these tools and think about how might you use them for ordering, for your results, or getting back that data that you're looking for. We went through the entire breakdown of the anthropometrics body composition information. There is so much information inside of those nutrition physical exam packets. When I was at IFM in my full-time years, it was a grueling experience to generate those documents. We had teams and specialists and contractors who worked for 5 years in creating you all these nutrition physical exam tools and the food plans. And then when you look at the list of citations and references in each and every one of those packets, it is truly remarkable what has been created. So note again that there's a beautiful document for you to explore the blood pressure guide. Okay, that's one of the tools that I want to remind you that you've been exposed to this week, and they dive obviously much deeper into this in the cardiovascular module. So just examples of some of our gathering and our educating and our organizing resources. So do you feel pretty good about PFCMvp? Okay, let's do this together. Say PFC. That was so weak. This is homecoming. Let's try again. PFC. MVP. PFC. MVP. Okay, you know why we did that? Because if you hear it, you see it, and you say it, your attention goes up. I want you to remember this when you get home. I know it's corny. Thank you. Okay? I'm like the queen of corn on this whole entire team. My humor is the dorkiest, and I'm owning it. So another tool that I want you to know about, this tool, this 1 3-page tool took 6 doctors in 1 year. Gray hairs. Because I had to get everybody to agree. So this tool, get this tool printed out. It's the biomarkers tool. It's the PFCMvp biomarkers lab tool. This gives you primary, secondary, tertiary column. Okay, this should be on your desk at a glance when you need it. When you're thinking, okay, does my patient have magnesium deficiency? How am I going to assess my patient's fat needs? My patient has no budget for labs. What can I do? Or I'm in an executive physical. My patient's struggling with these areas. I need to evaluate all these components. Then dig in there and see what other opportunities you have. Okay, so this is a navigation guide for you. Not to be memorized, to be used as a reference tool. Okay, so this in and of itself is a study guide. Okay, also when it comes to the biomarkers, the labs, you've got these beautiful resources where you can go to and say, oh, I wonder which labs I might be interested in ordering to go find that. Okay, so make sure that you're leveraging these key tools because they're guides for you to know how to find the information and do a deeper dive into your assessment process. So as we saw with Dr. Stone, quality, quantity of the foods matters. It's equally important that we look at the context of the symptom or the finding that we're looking at. And eloquently looking at this constellation, the points of connection that happen as we're putting that data and that information together. So how do you go find this stuff? Okay? We've got all of these unique physical exam components, advanced learning opportunities for you back inside of then, again, inside of the learning system at IFM. So all of you have been automatically enrolled in getting access to this online learning experience just by signing up for this course. So when you go into your own account, you're going to notice now that there's a nutrition-oriented physical exam called Insight. Right? Isn't that cute? Insight, helping to get you deeper insight into what you're looking for in your physical exams. So you have access to diving into some of these components of the exam, and you'll find that there's a review of how do I do the exam? Why do I do the exam? What equipment do I need to do the exam? Then we go through how do you prepare for the exam? And then you'll notice that we have filmed these expert clinicians doing that physical exam in real time. So you can watch the flow and how they're talking to the patient. And then we refilmed them again with the clinician telling you what it is that they're thinking while they're doing the exam. And then there's a summary at the end of it. Like, oh, it would be my dream if these resources and tools ended up in the hands of residents, right? Medical students and residents. Powerful tools. So this is how you find them. There's quite a few of them. The free quick reference guides are available for blood pressure in our anthropometric section, the dental exam, which you go in great depth in the detox module or the biotransformation module if you're involved in that, the skin exam and the nail exam. Okay, so those are available for you to jump right in, click into the program, and go in and look at any and all of the videos and then download those resources. Okay, next, as a reminder, you have the diet and the diet, nutrition, and lifestyle journal to draw upon. So again, please use these tools. I love to give these to new patients for a couple-week window, give them the assignment to start tracking and writing down and showing me what it is that they're eating. And what I love to do is play off of the phytonutrient aspects. I ask them to flag protein, fats, and carbs. I want them to connect it to the lifestyle base, because when that tool comes back, if they haven't checked any PFC, you know what that tells me? They don't actually know what's protein, fats, and carbs when they're eating. Like, it gives me so much insight and information about what do they know and what do they need, and how can we help them. So there's all kinds of advanced tools that once you get into your groove with them, you can have them using apps or you can have them using different types of online assessment tools. There's a lot of great resources out there. But this is designed to get the conversation started, shift the patient's level of awareness, have them focus on themselves, right? And be able to come to the table and start realizing that maybe their food choices might be connected to their stress or their lack of sleep or their struggles in their relationships. So this tool is really designed not to meticulously track their diet and shame them for what they could have done better. It's designed to bring a level of awareness and to start this movement of accountability, and again, to shift that locus of control from the doctor back to the patient. Okay, so use this tool as part of how you're building connection and getting to know them. Okay, that's what it's there for. Okay, so when you look at the various different interventions, you have been meeting these tools all week long. And like I said to you, I would like it if you would please take this tool, your prescription and lifestyle plan, and work on it. Either throughout the rest of today or maybe on your flight home. But can you make a commitment to yourself for what it is that you're going to do different? I remember one year teaching this program, and I was realizing how exhausted I was. I was holding literally like 30 more pounds of body fat, and I was thinking, I'm exhausted. I got 4 kids. I travel all over the world. I am like seeing patients all the time. I'm full-time at IFM, and I realized, like literally, as I was doing my own sheet, I am not sleeping enough. And when one of my mentors said to me, you know, if you're not getting at least 6.5 hours of sleep every night, you know, the average woman may be carrying somewhere between 8 to 10 pounds of extra body fat. That is all I needed to hear. I was like, what? I mean, I already knew that, but like, however, like that just like I gotta start sleeping. I gotta start sleeping. And I literally started prescribing sleep for myself. And I stuck to it. And I changed my kid's schedule. And I'm an early riser. Like, my body loves to get up before the sun rises. Like, I pop out of bed this happy when I get up in the morning. It's just pathological. My kids are not okay with it. I'm like, it's time to get up for school. Dance party in your mom. Right? I am an early person. I love to get up. And so what I realize is because my biorhythm, like my clock genes are set that like I'm up in the morning defending the camp. I'm watching. I'm the morning shift. Right? So in order for me to acknowledge my own biorhythms, like I had to put myself to sleep at 9. My kids were also not happy. Like, we're going to bed. Starting the process at 7:30 if you want people to sleep at 9, right? Parents would realize this is how it works. There's no such thing as saying we're going to bed at 9, 5 minutes before that. It's a total 90-minute process. It involves the getting up and more water, and I need another snack, and did I remember to tell you when so-and-so said this at school and it hurt my feelings? It's a 90-minute process. Right? Pre-teach. Just so you know, we're going to bed in 30 minutes. Just so you know, your teeth should be brushed. Like, this is how you do patient care too, right? Like, all of my best coaching skills I learned in my early childhood parenting classes. Really, I'm not kidding. It's the same techniques. Pre-teach. This is what's coming. Just be prepared. Hey, we're doing this in 5 minutes. And then this one amazing tool I learned that I'm not even going to be embarrassed to say it out loud. One of my most powerful tools that had to do with learning how to deal with my boys compared to my girls is one of my coaching techniques. And they said, I'm loquacious. Did you notice that I'm a talker? Monique and I, when Dan Lucasey is in the middle of me and Monique, he doesn't even have a chance. So I learned this technique and I use it with Dan. 5 words or less. When you really have something you want them to hear, you can't say it in this beautifully crafted sentence. You have to say 5 words or less. Shoes, sit, now. Like what I used to do. You know, we're going to be leaving in like 10 minutes. I need you to go put your shoes on, grab your backpack, and let's get out in the car. They didn't hear anything. But the girls are like already packing their art supplies, and what do I need in 2 days from now, Mom? So here's what I do. Boys, skateboards, car, helmet, clothes, 4 days, skate shoes. And it works. Who would have thunk it? So how you deliver the message, do you see my point? It's behavior modification. It's getting people to do things that are time dependent. That really helps with patients. So you're going to have to adapt the way you talk to the patient about these subject matters. It doesn't work if you give the same spiel to every single patient because their learning skills are different. They may be an intellect who wants a checklist. Right? You have to know where is the patient or the client at because that same information, you have to have multiple vehicles and ways to get it there, right? Okay, so your nutrition tools. Prescribing the nutrition plan. Prescribing, ha ha ha. It's not as though you write it on a piece of paper, give it to them and say, I'll see you in 3 months, good luck. It does not work that way. Especially our food plans are designed to transform their relationships with food. Right? They're meant to be introspective. Right? These food plans are meant to be a journey, and we're not just going on a diet here. We're helping them make these gentle, subtle changes over time, which means we need to be mindful, and we need to order things in the way we want them to focus on things. And we have to meet them where they're at and their readiness to change. Okay? So at the top of this prescribing document, again, I want you prescribing to yourselves. You'll see that there's a list of all the primary IFM food plans. And you'll notice that those on the left and those in the first step intervention are foundational functional nutrition and our first step interventions. You'll see that those are the ones we covered here because those are the ones we want you to master and get comfortable with first. Okay, it includes your core food plan variations. It includes your elimination diet and includes your cardiometabolic food plan. But you know what? We've got 9 more. And when you go into each of the advanced practice modules, you're going to take a much deeper dive at the way in which you're implementing the elimination diet, and you're going to learn about the renew diet. And when you go to the detox module, you're going to learn when and at what point might you differentiate between the detox food plan or the elimination diet, or you might choose to use the renew diet. Okay, so in each and every module, you're going to layer on top of this learning journey. Okay, but you're to leave here with at least the basic foundational tools so you can get started. And honestly, if you can master the suite of these tools, which is the core food plans, the elimination diet, and the cardiometabolic food plan, you are honestly going to be able to touch and transform somewhere between 60 to 80% of the patients already walking through the door. Are you all the way down to the level of their most personalized, precision, unique dietary plan? No. But are they remarkably better than where they started? Yes. Right? So it's a shift in the right direction. Especially if you find out my patient doesn't even know what's a fat. They don't even know the difference between a good fat and a bad fat. My patient doesn't include any fruits and vegetables in their diet. Right? You may spend a year teaching them, or your coach or your nurse or someone on your team may be teaching them fundamentals of healthy, good quality eating. Right? Before they can even get to that really challenging plan. So know that on this list, this is our summary spot where you can start by saying, all right, which plan am I going to pick? So as we initiate our care, we're going to think our way through this model that IFM has pulled together where we start with the basics, the most important fundamental things that we need in nutrition. And honestly, we built that section last. That middle column of all the advanced food plans is where we started because here we teach food as medicine. And then you know what happened after a few years of having those plans out? We had healthcare providers who have not been adequately trained in nutrition, like kind of whispering back to us, nobody taught us this in med school. We need more tools. We need more resources. So we went back in, and the writing team and the nutrition team at IFM built this beautiful suite and added over 24 more tools and resources for you to use, like what is a glycemic impact? And why organic? Right? What are good fats? What's an anti-inflammatory diet? So you're going to find this very robust suite of resources and tools that are in there for you to be able to educate the patient and educate yourself or educate your staff on some of these important things we would call nutrition, healthy eating 101. Okay, so do dig and print those out and use those resources. So Sid Baker, who is truly one of the leaders in this field, often considered to be the grandfather of functional medicine, if we consider Jeffrey Bland the father of functional medicine. When we look at that lineage, I love this quote. A therapeutic intervention is fitting the treatment to the individual. And in that sense, it's like tailoring. Measuring, trying it on until you get a good fit. And you know what? You don't always get the right fit the first time. Isn't that great? Like, that's what we're doing when we do nutrition personalization. We're going to get them started, then we're going to tailor it. Then we're going to get back more data, and we're going to hear how they're doing with it. And we're going to know more about the case, and then we're going to adjust it again. And then we're going to often adjust it again. Right? So know that it's a transition. It's a transition over time when we're working with the food plans. So the fundamentals. We have broken this into basically what we consider the depths of the 4 rings of nutrition. So if you can think about the fundamental section as almost like a plate, okay, these are the 4 areas that we like to cover. Now, there are some great tools like Introduction to Functional Nutrition for Patients. We have a version of this that's written for practitioners. So if you want to start educating peers in your practice or in your community or at the hospital or across the city in a referring building, we've got tools in there that you can print out and you can give to those other docs or providers to say, this is what we're doing in our office. Okay, and so the tools take us through the different layers. As you've obviously seen this week, we're going to be looking at all the multiple aspects of how and why food is so important. Right, so first of all, food is energy, right? Nutrition 101, taking us all the way back to the 60s and 70s, looking at calories, okay? Calories matter? Yeah, calories do matter. Is it all about calories? We know it's not all about calories. It's not about the total number. It's about quality and our quantity. It's quality and quantity. And we do know that there are certain food plans that are more effective and you get better clinical outcomes if you give your patient some guidance in directions of how much protein, fats, and carbs, right? As you would assume, Those conditions where we're using a food plan that's dealing with the glycemic and insulinemic surge, those food plans have some caloric targets to them, right? On purpose, intentionally. Some food plans can be given with no therapeutic recommendations specific to calories, and other plans, it's really important that you get those calorie allowances in the right zone. But especially the vegan, the vegetarian, and the pescatarian diets, it's really important that you're educating on those categories, because often when someone's removing animal products from their diet, if they're not educated and understand how to get that powerful food from medicine from food, that way around. If they don't have that innate skill set, often when you look at their diet diaries, they're so carb heavy. They're carb heavy, sweet heavy, and wrong fats, right? Inadequate and wrong fats. So basically, a lot of the vegetarian and vegans that do come in my door who haven't been properly educated in how to balance their diet, they come in with a lot of blood sugar issues, metabolic toxicity, and a lot of body fat issues, right? And it's impacting their neurology, right? So it's really important that we guide and we direct and we support in that manner. So the macronutrients are sometimes going to be an important consideration as you're working through the food plans. Okay, micronutrients, we're going to touch that through our various different levels of color. So we've learned this week in many different ways how and why we can consider food to be information. Right? So as we're eating these various different meals, we are washing information over our genes. Right? This is the interface. This is epigenetics. Right? This is our genetic potential. How do our foods inform how we express ourselves? So in the realm of food as information, one of the simple and powerful tools that you can use, it is simple, it is easy to understand. You can teach this to the preschoolers. Truly. And I go in and I do education classes at my kids' elementary schools, and I take this handout in and we talk about it. We talk about the power of eating in a rainbow. And if you're going to attend the detoxification elimination module, what you're going to see in that biotransformation conversation is you're going to have Dr. Deanna Minnick there, and she's going to teach an extremely robust deep dive down in the food plan. And then you're going to have Dr. Rick Mayfield taking you through another 3 hours of the science behind the power of those phytonutrients as it relates to specific enzyme activation and detoxification pathways. Okay, this is a great tool. It's a simple tool. You have it in your toolkit. So maybe you could pull it out if you've got your folders with you. And one of the first things that I have patients do when I'm using this tool in my office is I'll say, hey, can you take a look at this list and can you circle all of your favorite fruits and vegetables? You know, or sometimes if I'm running late and I know I'm going to do a nutrition consult with the next patient, I'll tell my front office manager, hey, Britta, do you mind, will you give them a phytonutrient sheet and ask them to circle the foods that they're including in their diet? You know what I love about that? These are the foods they really like, so I already know where we should start to reinforce healthy behaviors, right? And then I can look to see where's the gap, because that's what I want to know. Like, where's the gap? What colors are they not eating? Honestly, after looking at hundreds and hundreds of these, most of my patients are eating lots of red, lots of green, and maybe a couple other specks of other color. They just tend to be the defaults for a lot of the patients that I see. So it starts the conversation. Right? And then we can say, well, let's look at some of those other lists. Can you check off things you might be interested in bringing into your diet? And then we can talk about, well, how are we going to get those other additional colors in your diet, right? And why do we want the colors? We want the colors because all those different phytonutrients are talking to your genes. And we want the variety. We want the phytonutrient diversity and density. And that's what we heard also this morning from Dr. Hazy. So you can imagine the Mito food plan, the Keto Flex food plan, the brain-tweaked formulation of that food plan has a lot of robust phytonutrients. So does the detox food plan. When you look at the detox food plan, you're going to see a whole section of your fruits and vegetables divided into different pathways and categories that provide the adequate support to drive those unique conjugating pathways linked to phase 2 of detox. So we can keep going and get more specific, but this is your starting point. This is kind of your jump point, if that makes sense. Okay, the packet that goes along with this food plan is huge and it's fantastic. There's a huge, robust, deep dive down into this comprehensive guide where they go through and in just this beautifully eloquent way teach your patients why the color is so important in their meals. And so note that with every food plan, you're always, every suite, I would call it, it's a suite. In every suite with our food plans, you're always going to have a food list. Okay? There's always going to be a big packet that's designed to educate your patients. Okay? And they're colorful and they're beautiful and they cost like $900 to print and color. Just kidding. I email them to my patient. And the reason is I want them to see them in color. They're beautiful in color. They're brilliant teaching tools. Right? Or you might have one at the front desk and say, here, this is what we're using in the office. I just emailed you this, so you've got it at home. Either print it at home or read it at home. Okay, so get these tools into the patient's hands. The FAQ section, those are the primary questions that your patients are going to pick up the phone and call your office with anyway. So direct them to the FAQs. Say, first start looking through the food plan, dive into the FAQs, and when you come back next week, let us know where we need to keep going and where are some of the challenges and the kind of questions that you have. Okay, so give them the assignment as part of their treatment plan. So like I said, you're going to have a food plan list of what's included. You're going to have a robust, comprehensive guide that's going to actually take you through this review of the why. There's a huge, and I mean huge, bibliography that's annually updated for every one of the dozen suites so that you have the latest citations. So when your peer or a specialist calls you and says, why in the world did you prescribe the cardiometabolic food plan? Or what is this Renew food plan? You can say, well, let me send you the bibliography, and I'll send you over the documentation, and you let me know if you have any questions. Okay, so we did that because we want to make sure that every year we're tweaking, we're updating, and we're modifying these food plans to be relevant and common.